Bringing to you live and direct, this is Group 3, topic raising awareness and promoting prevention of sexually transmitted infections in older population. Open quotations, close quotations on the older population. So in Group 3, we have Chelsea Brathwaite, Leanna Bartholomew, Abigail Moore, Timna Ferguson, Macy Hutchinson, Maggie Genie, and myself, Peaches Hagley. So today, guys, we're going to do a little skit. It's going to be on Mary's Awakening, Protecting Our Golden Years, aka we can say Golden Girl series, okay? Our outline entails the introduction, community strengths, community needs, statements of the problem, and we'll jump right into it with our little skit. In and between our presentation, and not to leave out, measuring success, monitoring and evaluating interventions, and then our conclusions. As you can see here, these are our outline. Here we go. John dead. What do you mean John dead? John dead? My husband is gone. John dead. Oh God! John! Not dead, John! Oh God! Lord. Okay. So let's get into the tale of what really happened. Mary was having sex with John. John and Mary enjoying the sex, obviously. Tutus. Next thing you know, what happened? John dead in between the sexual act. Can you imagine? Mary said to herself, who the hell am I going to have sex with now? Who am I going to do the ooh-ah? With? Look at my age. I supposed to go there and do what? Well, this is my opportunity to go and see what I find. In truth, I should really go and see because John is the only person I had. Mary pondered and pondered. Days passed. We entered a new month. And here we go with our presentation. Starting off with the introduction, bridging the gap, promoting STI awareness and prevention in older adults. Why address STIs in older adults? According to research, 21% of the new HIV diagnoses globally in adults aged 55 plus, and condom use is 10 to 20% lower in adults, according to CAFA. Let's focus on Grenada. Nurses can lead STI education and prevention efforts. However, Grenada reports a 17% increase in STIs in older adults. Years passed by, and Mary was still pondering. One day, she decided to meet with the girls to talk about what's happening with her. So let's call it a girls' day, coffee day with my girls. Let's watch.
Hey ladies.
Hi Mary.
I have some news. Apparently I met someone.
Oh, that's great news. That's exciting.
But I'm a bit nervous too.
Why are you nervous?
Because it's been so long and then we want us to use protection. But I don't think we need that because we're old already though.
Mary, you do. Did you know that STD rates amongst people over 55 have doubled in the last decade?
Oh, really?
Yeah.
I thought that was a problem just young people encounter.
No, it's for all ages.
Oh, I didn't know that. That's really, thank you for telling me that.
Yeah, of course.
Community strength. Accessible healthcare facilities in Grenada, such as 30-plus health centers. Strong community ties and participation, such as 60% involvement in community groups. Support from local NGOs like GPPA, and nurses can leverage these networks for outreach and education. Community needs. Lack of STI education. 72% of older adults are unaware of symptoms. Affordable STI testing needed. 45% cite cost as a barrier. Need for stigma reduction and public awareness campaigns. Nurses can educate, provide screenings, and advocate for accessible testing. Statement of the problem. Rising STI prevalence among Grenada's older population. Cultural stigma and limited access to resources exacerbate the issue. Nurses can address these issues through education, early detection, and care.
Hi, come in.
awkward saying this.
Why? Why do you feel awkward?
I'd like to get an STI checked.
Oh, well, that's all right. But to do that, you need to go to your primary care physician, or you can come in here on the doctor's days and simply ask him to just do a wellness check on you.
Okay.
You sure you're all right?
Yes, I think I'm okay.
Oh my. You're gonna be all right. Trust me. It's perfectly okay to just ask the doctor to simply do an STI check. It's perfectly right. When was the last time you had a pap smear?
Years ago.
You should definitely ask and get tested.
What about privacy?
No worries about privacy. Privacy is guaranteed once you step foot into this institution. I can guarantee that whatever you say with your provider and testing, by the way, you don't have to worry about it. The only person with access to the information is you and your healthcare provider. So I won't even know.
Okay.
You feel better now?
Yes.
When I did it, I felt very comfortable. I felt empowered afterwards.
Okay, thank you.
You're welcome.
For prevention/strategies for STIs, we plan to have nurse-led educational workshops in health centers and communities. Also, mobile clinics providing free STI screenings and media campaigns featuring local nurses to normalize STI preventions, and we also plan to partnership with GPPA and other local health organizations. So our implementation plan is step 1. We're going to identify target groups, focusing on rural and urban older adults. Step 2, we're going to engage stakeholders such as the Ministry of Health and GPPA. And nurses will ensure culturally sensitive program design and delivery. To continue with implementation plan, we're also going to do step 3, conduct educational workshops using evidence-based materials. And to end step 4, we're going to monitor and evaluate program outcomes through surveys and clinical data. Unfortunately, there are some barriers to sexual health education and testing, such as older adults often face social stigma and shame when discussing sexual health issues. 58% of Grenadians aged 50 plus feel embarrassed to discuss sexual health. Noteworthy general assumption and not factual. And lack of awareness. Many older adults are unaware of the risk factors for STIs, assuming they're only relevant to the younger population.
Barriers to sexual health education and testing continued. Access to resources. Access to sexual health resources, including testing and counseling, can be limited for older adults. Transportation challenges affect rural populations, where 30% of older adults lack regular clinic access. Addressing misconceptions. Myths about older adults and sexuality is that older people don't have sex, and STIs are a young person's problem. But in reality, older adults remain sexually active, and they are susceptible to the same infections as the younger population.
Guys, I have a quick quiz for you. True or false? Do adults use the condoms?
False.
No, that's true.
No,
Cool.
girl, we're too busy worrying about wrinkles.
Correct. That's why the numbers are rising.
Okay, my turn. Can we get an STD from someone who does not show symptoms?
Yes.
False.
True.
Many people don't show symptoms, but they can spread the infection.
Okay.
The importance of routine STI screening. 1. Early detection. Routine STI screening allows for early detection and treatment, minimizing the risk of long-term health complications. 2. Prompt treatment. Early detection also enables prompt treatment, preventing the spread of infection to others and reducing the likelihood of long-term health consequences for the individual. And 3. Promoting safer sex practices. Regular testing promotes safer sex practices by providing individuals with the STI status.
Mary, look at this. The CDC says that we're the fastest growing group for STIs.
Wow, I had no idea. We need to tell everyone about this.
Yes.
Roles of healthcare healthcare providers in promoting sexual health. One, we have education and awareness. Two, routine screening. And three, referrals and resources.
Effective communication strategies with older adults. 1. Empathy and respect. Acknowledge the potential sensitivities and apprehensions older adults may have while fostering an environment of open communication. 2. Non-judgmental approach. This ensures the individual feels comfortable discussing their needs and seeking help without feeling ashamed or embarrassed. And 3. Personalized communication. Tailoring communication to the individual's need and preferences is essential. How to address stigma and normalizing sexual health discussions. Have open dialogues. Be educated. Have awareness. Breaking stigma. Promoting safer sex practices and condom uses. Condom availability. Having condoms available for you whenever you need it is one of the key things in helping prevent STI, STDs, or whatever else pose a threat to one's sexual health. Being educated about condom is also as important as condom availability. Things like knowing how to use a condom, when to use a condom, what type of condom to use. Some patients have allergic reactions to certain condoms, so it's best to educate them, let them know signs whenever they're getting allergic reaction to the condom. Sometimes the male population may not have allergic reaction to certain condoms, but the female ones can get certain reaction. So it's best to educate the population when handing out condom. Open communication is just as important as well. Talk to your healthcare provider, talk to your partner. You can even do self talk with yourself to be more comfortable when opening certain discussions with people. All of this helps with risk reduction. Resources needed. Human resources, trained nurses, nursing practitioners, volunteers. Financial support, funding from PAHO and other stakeholders. Educational materials tailored to older adults' needs. Nurses can provide leadership in securing and using resources.
Utilizing social media and community outreach. 1. Social media campaigns. Platforms can be tailored to older adults, which can reach a wider audience. Sharing information about STIs prevention, methods, and available resources can raise awareness and encourage testing among the demographic. 2. Community outreach programs can be organized in senior centers, community centers, and healthcare facilities, providing educational materials, workshop, and peer group support can foster open dialogue and increase access to resources. And 3. Partnerships with organizations. Collaborating with organizations dedicated to serving older adults, such as senior centers and retirement communities, allows for targeted outreach and tailored programs to address the specific needs of this population.
Social and cultural consideration. Integrate Grenadian cultural and religious belief into educational materials. Address privacy concern to encourage testing. 47% cite privacy as a barrier. Nurses can ensure confidentiality and create a safe environment for care. Pros and cons of the strategy. Pros: increase STI testing rate, 50% improvement of similar program. Note well, educated estimate made by students of this project. Reduce stigma and increase openness in communities. Nurses' involvement fosters trust and participation. Cons: sustainability concern. 30% of the health initiative faces funding challenges after year one. Note well, the exact percentage is unknown, but 30% is used for the purpose of this presentation. Nurses can train local staff to sustain initiative and seek long-term partnership.
Thank you, Macy. Now, having discussed all the intervention and possible ways that we can better improve the community, we cannot end on a note and not speak on the fact that we have to measure said outcomes. Now, the first way to do so is by data collection. Data collection, it refers to simply gathering information on the program reach and participation rates. A great example of this is recording how many older adults or the geriatric population attended these workshops and utilized the STI screening. Now, performance evaluation is when we can ask the general public, where did you learn about our STI screenings? Anything really to get a sense of feedback to know whether or not our interventions are as successful as we would like them. And while this may be tricky to actually get in terms of having the information on file, we can possibly hand out surveys for said residents to complete. And finally, but not forgotten, we have the outcome analysis, comparing the rate and the number of new STI cases reported before and after implementing the nurse-led initiatives. I hope that this clears up and this presentation was successful in everyone's thinking of the geriatric population and the problem of the STI rising in Grenada. Now, finally, after having this entire presentation, I hope we have the understanding that nurses are the ones to make the change. We are the trend starters to make the change. We are essential in addressing the STI problems in Grenada's older population. And for that, I would simply like to call you, the nurses here in today's audience, to start the process, take the initiative, start the activities, and also in starting the activities, we have to remember that education is key. Yes, grandma may be old, but that doesn't mean grandma can't learn a new thing. Education, prevention, and early detection will certainly by far improve the public health situation in Grenada. Finally, before I conclude, on behalf of my group, I want to say thank you to each and every one of you who have listened to this presentation and are inspired to make a better change in Grenada's population. And also on behalf of myself, I would like to thank each and every single one of my group members for making this presentation possible. And thank you, Miss, for listening.
Thank you for everything. I feel confident now.
That's lovely. However, we have a health fair coming up on this Friday at the stadium's car park. It will be starting from 9 a.m. I would really like if you can attend so that you can get little examinations done. There will be free STI testing and they will also be able to get a mammogram, first examination at the health fair. And remember, it's all about condoms, okay?
Thank you. Awareness will help a lot of people and it will save our golden years.
Yes, we'll go.
Thank you.
You're welcome.
Santa, tell me if you're really there. Don't make me fall in love again if you won't be here next year. Santa, tell me if he really cares. 'Cause I can't give it all away if you won't be here next year. Feeling Christmas all around and trying